Do you know how to recognize the early signs of a stroke? It's a question of paramount importance. In the world we live in today, strokes are one of the leading causes of death and disability. Understanding the early signs of a stroke, recognizing them, and acting quickly can make a world of difference. It can mean the difference between life and death, between full recovery and long-term disability. Knowing these signs could save a life, maybe even your own. First, let's understand what a stroke is. A stroke is a serious medical condition that occurs when the blood supply to part of the brain is cut off. Without blood, our brain cells can be damaged or die. This damage can have different effects depending on where it happens in the brain. It can affect the body's functions, thought processes, or even personality. There are two main types of strokes. The most common type is an ischemic stroke, caused by a blockage cutting off the blood supply to the brain. This blockage often forms in areas where arteries have been narrowed over time by fatty deposits. The second type is a hemorrhagic stroke, which happens when a blood vessel within the brain bursts, causing bleeding. Strokes are a medical emergency, and swift action is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. It's crucial to note that strokes can happen to anyone at any age. They don't discriminate by gender or race. It's also worth mentioning that there are things called mini-strokes, or transient ischemic attacks, TIAs. These are like strokes, but the blockage is temporary, and the symptoms usually disappear within 24 hours. Now that you understand what a stroke is, you can better recognize its early signs. One of the easiest ways to remember the early signs of a stroke is with the acronym FAST. Let's delve into what each letter stands for, shall we? First up is F, which stands for face drooping. If one side of the person's face is drooping or it seems numb, it could signal a stroke. You can often spot this if their smile appears uneven or lopsided. It's a clear sign that something isn't right, and immediate action is necessary. Next is A, representing arm weakness. The person might experience a sudden weakness or numbness in one arm. You can have them raise both arms and see if one drifts downwards. If they're unable to keep one arm up, it's another key sign that a stroke might be happening. Moving on to S, this refers to speech difficulty. The person's speech may become slurred or strange. They might have trouble speaking or seem confused. Ask them to repeat a simple sentence. If their speech is hard to understand or doesn't make sense, don't waste any more time. Lastly, T stands for time to call 911. If you notice any of these symptoms, even if they go away, call for emergency services immediately. Note the time when the first symptoms appeared. This is crucial as it can affect treatment options. The sooner medical professionals can intervene, the better the chances of recovery. To reinforce, F is for face drooping, A is for arm weakness, S is for speech difficulty, and T is for time to call 911. These signs are critical in identifying a stroke in its early stages. By knowing and recognizing these signs, you're equipped to act swiftly. Your quick response could save a life, prevent long-term disability, and ensure the best possible recovery. It's a simple tool, but it carries a massive weight of responsibility. So, engrave this acronym in your mind. Share it with your loved ones. Let's all be guardians of our own health and those around us. Remember, FAST could be the difference between life and death. Besides the FAST method, there are other early signs of stroke you should be aware of. One such sign is sudden confusion. This isn't simply forgetting where you left your keys or struggling with a difficult crossword puzzle. It's a profound, abrupt difficulty understanding speech or expressing thoughts. A person experiencing this may suddenly be unable to comprehend what's being said to them, or they may struggle to articulate their own thoughts clearly. They might even be disoriented, unsure of where they are or what they're doing. The next sign to watch out for is trouble seeing. This can manifest in many ways, such as blurring, blackening, or doubling of vision. It might affect one or both eyes and often comes on suddenly. Imagine trying to look through a fogged-up window or seeing double of everything around you. That's what it can feel like. Then we have loss of balance or coordination. This is more than just feeling a bit wobbly on your feet. It could mean stumbling or having trouble walking, a sudden inability to coordinate your movements, or an unexplained dizziness. You might find that you can't touch your nose with your finger, or you may drop things you're trying to hold. Finally, there's the severe headache. This isn't just your run-of-the-mill tension headache or a migraine. It's an intensely painful headache that comes out of nowhere. It's often described as the worst headache of a person's life. It might be accompanied by dizziness, vomiting, or altered consciousness. Each of these signs is a potential red flag. They indicate that something is not right in the brain. If you or someone else experiences one or more of these symptoms, it's crucial to seek medical help immediately. These signs might not seem serious at first, but they could indicate a stroke. It's better to err on the side of caution when it comes to these symptoms. Remember, every second counts when dealing with a potential stroke. So, what do you do if you recognize these signs in yourself or someone else? You may wonder. Well, the answer is immediate action. Time is of the essence when dealing with strokes. It's not the time for hesitation or wishful thinking. It's the time for swift, decisive action. If you notice any of the early signs of a stroke, whether they're from the FAST method or the other signs we've discussed, your first step should be to call for emergency medical help. This is true even if the signs seem to fade away or disappear entirely. Strokes can be tricky, and symptoms that come and go could still be indicative of a serious problem. While waiting for emergency services, it's crucial to keep the person calm and comfortable. If they're conscious, help them sit or lie down in a comfortable position. If they're unconscious, turn them on their side to prevent choking if they vomit. Remember, never give them anything to eat or drink, as this could cause choking. Now let's talk about treatments. The most common treatment for stroke is a medication called tissue plasminogen activator, or TPA. This potent drug works by dissolving the blood clot that's causing the stroke, restoring blood flow to the brain. However, it must be given within a few hours of the first symptoms for it to be effective. That's why calling for medical help at the first sign of a stroke is so vital. There are other treatments too, like clot removal surgery or procedures to reduce pressure in the brain. But again, these treatments are most effective when given soon after the symptoms start. The longer the brain goes without proper blood flow, the more damage is done. That's why it's so important to know the signs of a stroke and act quickly if you see them. It's not just about recognizing the signs, it's about what you do next. And what you do next could save a life. Remember, every second counts when dealing with a stroke. Recognizing the early signs of a stroke can save lives. This statement holds the essence of what we've discussed today. It's a simple, yet powerful truth that can make a world of difference. Let's take a moment to reflect on the key points from our discussion. We started with understanding strokes, a medical condition caused by a disruption in the blood supply to the brain. It's a serious health issue that can lead to severe complications, even death, if not treated promptly. We then moved on to the FAST method, an easy-to-remember tool that helps in quick identification of the early signs of a stroke. The acronym stands for face drooping, arm weakness, speech difficulties, and time to call emergency services. Remember, time is of the essence when dealing with a stroke. The sooner you act, the better the chances of recovery. Apart from the FAST signs, there are other early signs of a stroke that we should all be aware of. These include sudden confusion, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance or coordination, and severe headache with no known cause. Knowing these signs is only half the battle. The other half is knowing what to do if you recognize these signs either in yourself or someone else. Don't hesitate. Don't second guess. Call for immediate medical help. Every second counts when it comes to stroke treatment. In conclusion, it's crucial to remember that you have the power to make a difference. The knowledge you've gained today can potentially save a life someday. So, let's not take this lightly. Let's commit to staying vigilant, to staying informed, and to taking swift action when necessary. Remember, strokes don't discriminate. They can happen to anyone at any time. But armed with the right knowledge, we all have a fighting chance. And that's a powerful thing. Stay vigilant, stay informed, you could save a life.